Oxygenation, Introduction to Nursing Concepts. This is Martha Olson. We know that oxygen is a vital component for every living creature here on Earth. As we look at Maslow's, we know airway, breathing, and circulation are priorities when we care for others. And so oxygenation becomes a very important part of our assessment and treatment with nursing interventions. We know the function is gas exchange, getting oxygen to the cells, bringing the carbon dioxide back out, and without oxygen the cells will die. We see that with a myocardial infarction, when there's a blockage to the cells in the myocardium or in the heart muscle. With that comes the pain and the ischemia, the death of that tissue. We have a very short window of time that cells can go without oxygen before they die. And before that time, cells tell you that they are irritated because they are not getting oxygen, and that's what causes things like chest pain and neuropathies. When we look at a patient with anemia or a decreased hemoglobin, we know that they don't have enough red blood cells to carry the oxygen out to the cellular level. Anemia happens for a variety of reasons. Things like blood loss, postpartum hemorrhage. It might be a disorder with their liver. So many things can cause a patient to be pale, to be tired and weak, and those symptoms come from the lack of oxygen that's able to get to the patient. And the diagnostic lab test then obviously is a hemoglobin. Oftentimes you will hear it called an H&H, hemoglobin and hematocrit, and they kind of go together. A little bit of anatomy review looking at the lungs. We know the left lung has 2 lobes because it also has that cardiac notch in it. The right has 3 lobes. If one of those lobes is removed or surgically taken away, it would be a lobectomy. Ectomy is removal of. We know that the line here between the upper and middle lobe on the right side is a horizontal fissure, and the one down here between the middle and lower lobe is the oblique fissure. Down through the middle is the mediastinum. You see the trachea up here that brings air from the upper airway down, where it bifurcates off into the left and right. They are not symmetrical, and we know that the right main bronchus is actually wider than the left. When we talk about ventilation, it can be used in several ways. For the most part, it means inspiration and exhalation of air, but we also talk about a patient being ventilated. That means they're not breathing on their own, and we have them on a machine that is breathing for them, or they're on a vent. So you'll see that term used in many ways, and it's the process with the diaphragm and the intercostal muscles that causes the inspiration and exhalation of air. With broken ribs, it hurts to breathe, and many times patients will not take a very good deep ventilation or very deep breath because of the pain, and that can downward spiral then into things like atelectasis and pneumonia, because we know that all the airways need fresh air coming in with fresh carbon dioxide being eliminated. The process of diffusion is where that oxygen actually enters the blood, the carbon dioxide leaves, and we know that this happens in the alveoli. You see the special shape to those hemoglobin cells, those red blood cells, and that is because that concave shape gives the red blood cell more surface area, and it increases the hemoglobin ability to carry oxygen. We know some of the oxygen is dissolved in the plasma, but most of it goes on those hemoglobin cells. And then the act of perfusion is where the lungs receive the blood from the right side of the heart, the right ventricle. It goes through the pulmonary artery, and remember your anatomy where the pulmonary artery is the only artery in the body that carries unoxygenated blood. And then it comes back through the pulmonary vein, oxygenated to the left side of the heart. We know that the perfusion is able to take place because of the pressure gradient that's very different. In the lungs, the blood pressure is only like 30/12, 20/12, making perfusion possible. In looking at our normal oxygenation function, again, that heart is what contracts and pumps to push the oxygen around and to cause that oxygenation and perfusion to happen. It sends the waste products to the lungs where they're eliminated through the lungs and the expiration, and we know that the heart has to pump at least 60 times a minute in order to maintain the blood pressure and maintain that oxygen delivery. The heart is very muscular. If you work in a place called cardiac rehab, you know that that is usually a population where they've had an MI or a heart attack, and the damage has been done to that myocardium, or that muscle to the heart. And what we see then is that middle layer, that myocardium or myocardial fibers, very thick middle layer, causes the heart to pump and function just like a muscle. And so in cardiac rehab, we are strengthening that muscle for the heart. The endocardium is within, and that's what touches the blood. It's the inside of the heart, and then the outside is the epicardium, and that's kind of a thin-walled sac that helps kind of enclose or encase that heart together. As we look then at the valves, some people remember the order of them: to push me around TPMA. The tricuspid is between the right atrium and ventricle. The mitral is between the left atrium and ventricle. The pulmonic is after the right ventricle before it goes to the pulmonary system or the lungs. And the aortic is after the left ventricle before it gets to the aorta. The job of the valve is to ensure that the blood flow goes through only one direction. And with heart valve problems or murmurs, the blood is able to flow backward and cause problems. When you listen to a heart in lab, we will show you the 4 places to put the stethoscope on the chest to be able to hear the 4 different heart valves. And as you hear that, when it sounds kind of like a washboard sound, that is usually a heart murmur. The left side, remember, is systemic. The right side goes to the lungs, and the heart valves are separated from the ventricle. So as we look at the heart valves, they become important in keeping the blood flow going in that one direction that we want. Our factors looking at that heart being an effective pump would be the ability to fill and contract, empty and open. The strength, and that's where cardiac rehab, that myocardial, that middle layer of the heart, has the ability. Those people that are long distance runners that have a very strong heart and heart muscle may only contract their heart 50 times a minute, because when it pumps very effectively and it does a good job. And then the electrical conduction is very important. We will talk about that more when we get to some of our fluid and electrolyte issues, because your electrolytes, your potassium, your sodium, your magnesium, all affect the ability of that heart to function and have an electrical system that works to make the heart contract. A patient with hypokalemia, low potassium levels, will come into the hospital, be admitted, and we put them on telemetry to watch that EKG of the heart, because a low potassium or a high potassium have special effects on that pumping ability of the heart. When we look at the blood vessels, we know that the diameter is something we will be talking quite a bit about in this class. When we talk about a patient that stands and their veins, which are less muscular, do not contract, the blood pressure stays down into the extremities, and when the person stands, they get very dizzy because they don't have a lot of blood pressure coming up for them. The arteries are the opposite. They are more muscular, they're more elastic. And when we look at the difference in those in pharmacology, you will start talking about medications to lower the blood pressure that are vasodilators. When we look at the sympathetic versus parasympathetic system, we will be looking at the effects on the diameter of our arteries and our veins. So we know the coronary arteries take oxygen and supply to the capillaries. That circulatory system is very much interconnected with the endocrine system and with many of the other systems to keep us in homeostasis. Things like TED hose or our SCD, sequential compression devices, are used routinely on surgical patients because we want to keep that blood from pooling in the bottom of the legs when a patient maybe isn't walking or ambulating as much. Maybe they're on bed rest or have other issues going on. We don't want that blood pooling, because the ultimate result can be blood clots or DVTs, deep vein thrombosis. When we look at the function of the cardiovascular system, we know that it's to transport oxygen, nutrients, take the waste products back to be excreted, and then that healthy heart is essential. And in nutrition, we spend a lot of time looking at what you can do nutrition-wise to have a healthy heart. When we look at healthy lifestyle, exercise, and decreasing stress, and eating omega-3, all of that contributes to having a healthy heart. And probably the number one factor that I think about that is so preventable is the smoking. Smoking causes vasoconstriction, and it causes more problems with the vessels, and you see a lot higher heart issues with those that smoke. And so promotion of healthy lifestyle is going to be a big part of what you as a nurse will do with our patient population. Our perfusion then is needed to maintain life. That is where the oxygen is down to the cellular level. It is able to get through the walls of the capillaries, and it is diffused then by moving from a high concentration to a low concentration to the cells, and we see that exchange taking place then in the microcirculation of the body. As we look at air exchange, we know then that we have the trachea that comes down. It bifurcates off. As we talk about endotracheal tubes, remember endo is within the trachea is a tube that when you get into some of your more advanced nursing classes, you will talk about being able to intubate a patient, put a tube down so we can assist with breathing. Either they're not breathing at all or they have some difficulty with that. When we look at putting that endotracheal tube down, it only goes as far as this cariner, this area where it bifurcates off, because you don't want to only be administering oxygen and ventilations to just one side. That very powerful diaphragm assists with respiration by changing the pressure in the lungs to cause inspiration and expiration. And then the other very important part of this is looking at those little tiny grape clusters that are at the end of the airway, and those are your alveoli. On a newborn, they're flat. They have not been used in oxygenation. So for that baby that's just born, they have to have a lot more pressure to take that first breath, and that's why in the delivery room we're so glad when that baby is crying, because crying forces the air into those alveoli to help them expand for the first time. Babies that are premature don't have what we call surfactant, or the ability to open those alveoli, because it's like putting water in a balloon and then sticking the edges together when there's just too much surface tension. We also talk about the alveoli when we get to the elderly, because with smoking, with air pollution, with damage to those alveoli, we see some of our disorders and diseases like COPD, chronic obstructive pulmonary disease, emphysema. Those alveoli are kind of like a rubber band, and they stretch and they return, and they stretch and they return, but over time and with damage they stretch but they don't return, and the air builds up in there, the carbon dioxide builds up in there. They continue to take another breath, and those alveoli take in more air, but they're not able to contract and get the air back out, and what happens is they burst or they're damaged. You'll see a lot of your older patients do what we call pursed lip breathing, where they breathe in and then their exhalation, or the breathing out, is twice as long. It allows those alveoli to relax and allows the air to move out of them in that process of ventilation. So kind of in review of what we've talked about, the anatomy for the lungs, why perfusion takes place, and that has a lot to do with the different changes in the pressure. And as we look then at why this is important, it's a vital part of our nursing assessment and nursing interventions so that we can identify and treat patients very early with respiratory problems. Oxygenation is vital for life, and as we move forward on to the next unit, we will be talking about different factors that will affect oxygenation.